Hello and welcome to this special episode on Herald TV, powered by ASG Eye Hospital. Today, as we celebrate National Doctors Day on 1st July, commemorating the birth anniversary as well as the death anniversary of Dr. B.C. Roy, an eminent physician, Dr. late Bharat Ratna, the former Chief Minister of West Bengal. And this year's theme for National Doctors Day is Family Doctors at the Frontline. As you know, without the medical fraternity, the society would be in need, especially during the COVID times that we have seen how on the front line the doctors have performed and they have been the pillar of our social life. To shed light on one of the most important aspects of human body, and that is eyes, we have eminent distinguished doctors here today. With me, I have on my left first Dr. Sean Da Silva. He's the medical director of ASG Eye Hospital. Next to him is Dr. Aditya Kazwe, who is a consultant at the ASG Hospital. And to my extreme left is Dr. Chandra Prakash Oli, who is a medical consultant at the ASG Eye Hospital. I'll not get into the details of their intro, but jumping directly to the topic, I will discuss with Dr. Sean about glaucoma. And Dr. Sean, to begin with itself, can you explain to our audience what glaucoma is?
So I once again thank Herald TV for inviting my team of doctors at ASG Eye Hospital. And I take this opportunity to increase the awareness about glaucoma, which is extremely lacking today. And glaucoma, as we know, is the second most common cause of irreversible blindness, not only in India, but worldwide. It is a progressive disease which causes damage to the optic nerve in the eye, and that is important for vision. One of the risk factors being the intraocular pressure. Just like our body has blood pressure, the eye also has an intraocular pressure, which is one of the major risk factors. When you have a high intraocular pressure, it causes damage to the nerve.
So what exactly happens if you have glaucoma when you say?
So it's also known as a silent thief of sight, because in the initial stages of the disease, glaucoma tends to affect the peripheral vision. So although you can see straight ahead of you, whatever is happening in the periphery from the side of your vision gets slowly crowded, and finally in the last stage your central vision goes down. So in the early stages of the disease, it's important that the patient will not be able to identify. It's only on a routine eye screening where we check the intraocular pressure, we dilate the eye to examine the retina, and when we examine the patient who is at risk of glaucoma, then we undergo further tests to confirm the disease.
So, is there a certain age where one gets infected or affected due to glaucoma?
Yes, I think one of the important risk factors is we start screening all patients above 40 years of age.
Okay.
Definitely, if there is a family history, you will start screening much earlier if your father, mother, or any other person in the immediate family has the disease. But otherwise, as we grow older, nowadays with modern medicine, it has increased the average lifespan. And at every decade, the risk of glaucoma increases.
So when you say anybody in the family has it, so you're talking specifically about glaucoma,
Yes.
Hereditary in your family?
Hereditary, in fact.
Okay.
So,
Yes.
so although hereditary is not the most important risk factor, some patients who have a family member, we tend to start screening much early by doing certain tests to evaluate the optic nerve and to evaluate the peripheral vision, called as perimetry.
Okay. So, are there specific causes for glaucoma, or I mean, what could be the main reasons one gets infected? As you said, it's not necessarily hereditary.
Yeah. So, the exact causes is now in grouped of diseases called as multifactorial diseases. There are multiple risk factors to this disease, and some of the risk factors may be part of entirely our normal life. So there is nothing specifically related to the food intake or related to the exposure which causes as a risk factor of glaucoma. but the common risk factors include patients who have myopia, patients who have diabetes, patients above 40 years of age, patients who have chronic smoking. These are the possible risk factors, and we screen patients above 40 years irrespective of having any risk factors.
So it's basically, it's not even a lifestyle disease, so to say, but it could be one of the reasons that could lead to glaucoma.
Yes, yes.
And what would be the end result if glaucoma is left untreated?
Now, it's important for us to know that in most diseases, we are very well aware about hypertension and diabetes, is the earlier you detect the problem, you can bring it under control to the extent that it doesn't impact your day-to-day life. But unfortunately, what happens with glaucoma is because the awareness is very low, patients often come much later in the onset of the disease when significant damage to the vision has already occurred. At that stage, whatever damage has occurred is not reversible. But when we go for a screening test, when we go for a prophylactic eye test, that prevents the risk of coming up with advanced disease. Once you're diagnosed, most patients require medical management in the form of eye drops, which help to lower the intraocular pressure and help to maintain the health of the optic nerve and prevents further progression of the disease with frequent follow-ups. In certain cases where the medicines do not control the pressure, then surgery is required, called as glaucoma filtering surgery.
So, how does this disease progress, and how quickly does this? Does it become life-threatening, or?
So, in 90% of the cases, fortunately, the disease is slow progression.
Okay.
You don't see a very rapid progression, and in these patients, regular follow-ups every 3 months can help us to modulate the treatment protocols and keep the patient free of any progressive nerve damage to be able to maintain his day-to-day activities and lead a normal lifestyle.
Okay.
In a small percentage where the disease can spread or aggressively progress further, cases with narrow angle glaucoma or acute episodes of glaucoma, patients have severe pain, redness of the eyes, colored halos, and this can affect even young individuals, 25, 30 years of age. In these cases, the treatment has to be done rapidly and the pressures have to be brought under control.
Okay. So, what is the best treatment that you could suggest or is available?
So, I think more than looking at the treatment, it's important that patients proactively come for a regular eye checkup.
Okay.
On a yearly examination, instead of having just your eyeglasses tested, a basic evaluation involves to check your eye pressure and have a dilated retinal examination, irrespective of whether you have family history or not. On these screening tests, we can rule out or eliminate 50% of cases and then start treatment early in those cases where they have borderline disease and help to maintain the health of the optic nerve without any damage.
Okay. So, while we have just heard about glaucoma, which is not again a lifestyle related disease, but certainly there is something that is related to our lifestyle disease and affects our eyesight and vision and could affect your eyesight and vision, and that is diabetes. So I would want to understand how diabetes would affect vision from Dr. Aditya.
Yeah. So diabetes retinopathy is one of the leading cause for the blindness in working population. So diabetes, as you know, it is raised blood sugar in the body, and this raised blood sugar affects the blood vessels in the back part of the eye, what we call as a retina. Retina is the most important structure for the vision formation. So this raised blood sugar, it can cause weakness in the blood vessel and cause swelling in the retina, or it can cause obliteration of blood vessels and cause bleeding in the eye. And this leads to decrease in the vision, and patient come with the vision disturbances.
So how is diabetes, eye disease detected? I mean, an eye disease related to diabetes detected?
Correct. So the most and important factor is the comprehensive dilated eye examination. So as in early symptoms of the diabetes, the patient don't have any symptoms, is a asymptomatic disease. So when the patient came to an expert ophthalmologist, and by dilated retinal examination, the early signs can be picked up.
So and who is at a risk of developing a diabetes related eye disease?
Okay. Anyone with the diabetes, like type 1, type 2 diabetes or gestational diabetes, they can have the high risk of developing diabetic retinopathy. There are two important factors. One is the duration of the diabetes and what is the level of blood sugar in the body. These two factors play a key role in the progression of the diabetic retinopathy. Any patient having high blood pressure, blood cholesterol, or patient who smokes are also at increased risk of developing diabetic retinopathy.
Before I ask you the next question, there is always people tend to think that diabetes is not something that one will get attacked by so easily. So being on that back foot always, how detrimental would it be in this case?
Yeah, so actually the most of the time the patient are unaware of they have diabetes. Okay, so what happens is, as I just mentioned you, the diabetes in early stage is usually asymptomatic, and once their patient is not facing any problem, he is just living his routine life. But when the disease advances, there is a very severe vision loss which happens, and at sometimes it is irreversible. So early diagnosis and the treatment is the most important factor. So taking your annual eye examination is the most important thing what one should do.
Then, I mean, how would one be able to recognize that he is in that bracket? What are the symptoms of the diabetes eye disease?
Yeah, so the most of the patient in early stages, they don't feel any symptoms, but there are changes which are happening at the back part of the eye, which can be examined by the ophthalmologist and detected early. But as the disease progresses, patient may have a blurring of vision or fluctuation in the vision quality. Sometimes they have impaired color vision, or sometimes some patient can see black spots in the field of vision, what we call as the floaters. And in very advanced stages, there will be the total vision loss.
At this point, doctor, we'll take a small commercial break, and on the other side of the episode, we will learn more about the diabetes eye disease, as well as we will learn about LASIK surgery. Keep watching, come back, and we will have the next part of this interaction with Dr. Aditya as well as Dr. Chandra Prakash Oli. We'll be right back. Welcome back to this special episode on Herald TV powered by ASG Eye Hospital. Today we have with us Dr. Sean Da Silva, the Medical Director of ASG Eye Hospital, Dr. Aditya Kazwe, and Dr. Chandra Prakash Oli, and we are talking about healthy eyes. Before going into the break, we are talking about the diabetes-related eye disease, and I would continue further, Dr. Aditya, as to how is a diabetic eye disease treated? What are the treatments available?
The first and most important step is the controlling of your patient's blood sugar and blood pressure. Then according to the stage of the disease, there are different stages of the disease. Your ophthalmologist may treat with the eye drops, or sometimes with the injections in the eye, what we call as an anti-VEGF injection, to reduce the swelling in the back part of the eye called as retina. In some patients, we require to do laser therapy to prevent the bleeding in the eye. And patients who have advanced diabetic eye disease, they might require a retinal surgery also to prevent the loss from vision loss because of the diabetes.
So this is surgery is more a treatment which is available for this disease.
Yeah.
So since it's diabetes related, like normally we talk about diabetes also a preventable lifestyle disease. Yeah. So is diabetic eye disease also preventable?
Yes, true. So what I did first I started my line is the annual dilated eye checkup is the most important factor for prevention of the diabetic eye disease, because when we see and check and treat the patient in early stage, the vision loss occurring because of diabetes, it can be totally prevented. So the healthy lifestyle along with control of your blood sugar, blood pressure, cholesterol level, and avoiding smoking, all these are the key factors to prevent the vision loss which is happening because of the diabetes.
Thank you, Doctor. Dr. Chandra Prakash Oli,
yes.
I mean, normally people hear about LASIK surgery, but most of them are not aware as to what LASIK surgery is. So could you please shed some light on that first?
So LASIK surgery is basically an eye surgery to get rid of the glasses or contact lenses. So people who wear glasses or contact lens, they don't want to wear glasses or contact lens, then we have a surgery which is known as the LASIK eye surgery. So actually it's a short form of a laser assisted in situ keratomiliosis. Basically in LASIK what happens is we change the refractive status of the eye, means we change the power of the eye, and that is done by using a special type of laser which is known as the excimer laser, and this is used to sculpt the front part of the eye, which is the cornea. The front part of the eye, we sculpt it with using the lasers, and the refractive status of the eye changes, so the person after the surgery will not require glasses or contacts to see clearly.
So basically, if it's just a more detailed question. How does the surgery per se work? I mean, when you say you sculpt the eye,
Yeah.
So beyond that, just for a common man,
Yeah.
Because nowadays laser surgery has become, a kind of a cool tag.
Yes,
But
yes.
for somebody who is more interested in knowing what actually would happen
Yeah.
with his eye, so how does it work?
So this is one of the most commonly performed eye surgery and having a very good result also. So to see any object, when you want to see any object, the image of that object should get focused on the retina, and that focus is based on two parts of the eye. That is, one is the cornea and other is the lens. So in LASIK what we do, the front part of the eye, which is the cornea, which is the most important part to focus, we change the refractive status, means we change the power of the eye. So suppose a person is having -1 or -2 power and he wants to get rid of the glasses. We will do the LASIK or a laser surgery on the cornea and remove that power, so that he will not require glasses to see clearly. So basically it is like how we sculpt the stone to make statue. Similarly in the eye, we using lasers, we sculpt the cornea, the front part of the eye. And because of the change in the refractive status, the patient is able to see clearly after the surgery.
So who are the, what kind of patients, I should rather say,
Yeah.
are ideal for a LASIK surgery?
Yeah. First important criteria is that the age should be more than 18 years.
Okay.
And second important criteria is the number should be stable, means the power should not fluctuate. Suppose the power fluctuation, how we see is that within a year it should not increase more than 0.5. Suppose you are having -5, after 1 year it's become -6, then we can't do the LASIK. The change in the power should be less than 0.5 in a year, then only we can do the second criteria. Third criteria is you should not have some autoimmune disease like rheumatoid arthritis or dry eyes. In those conditions we can't do LASIK. And the important step, as I've told, that LASIK is done on the cornea. The thickness of the cornea is very important for us. If the cornea is very thin, we can't do LASIK. So adequate thickness of cornea is required while performing LASIK.
Yeah.
So these three main things we see. One is the age, other is the stability of the power, and third is the thickness
So
of the cornea.
when you say age, what is there any specific upper age limit, or within this age somebody can be operated, or
No.
is it?
There is no upper limit. There are different type of LASIK. It is more popular in the younger age group because LASIK usually corrects power for distance.
Okay.
And after 40 years we require reading glasses. So there are special type of LASIK surgery which can be performed after 40 years of age, but those are not very popular because the results are very variable in those cases. But it can be done.
And is LASIK surgery painful?
No, it's not painful. It's very safe and predictable and precise surgery, because what we do is before performing the actual procedure, we put numbing drops in the eyes. With the numbing drops, we don't feel any pain during the surgery. Slight pressure or slight touch sensation you will feel, that's it. And hardly the surgery takes 5 to 10 minutes in total. So it is very quick surgery and painless surgery.
It's within minutes that the surgery is over.
Yes, yes.
But then how quickly can one be able to see after the surgery is
The
performed?
vision is usually like very clear after the surgery immediately, but still we tell the patient to wait for at least a week to avoid any outdoor activities and all those things. But patient is able to see clearly immediately after the surgery.
So normally we see people when they are undergoing normal surgeries, they wear some specific glasses, or they are told to cover their eyes. So
Yes.
in this kind of a surgery,
Yes.
what
In
is
this
the
kind of
precautions?
surgery, we tell the patient to avoid any exposure to UV rays, because that affects the healing of the LASIK. So you have to wear UV protective glasses for at least a week, and should not go outside in the sunlight for a week.
Okay. And since you said this, about the lens part of it. So, can someone wear lenses before the surgery, and how does it change later?
Yeah. So if you mean to say the contact lens?
Yes,
Yeah.
contact lenses.
So if a person is wearing contact lens, then usually we do certain tests to see whether you are fit for LASIK or not. We call it as LASIK screening. So if a person is already wearing a contact lens, those tests, the results of the test, sometimes it comes error in the test. So if the patient is wearing a contact lens, then he has to avoid contact lens for at least 1 week, and then come for a test and to check whether he is fit for LASIK. So that is required. And anyhow, after the LASIK, you will not require to wear.
So it is basically one has to get himself or herself tested before.
After 1 week of contact lens.
Okay.
Of contact lens, after 1 week, you have to test your cornea to see whether you are fit for LASIK or not.
So while these are the very specific dimensions of healthy eyes, Dr. Sean, I would request you to just highlight a few issues that normally every common person looks at, like cataract and these issues which are very common, but yet people are hesitant to talk about, or at times even cataract is sometimes taken as a taboo in our common parlance.
No, I think over the years, perceptions have really changed. When I did my post-graduation in GMC in 2006 to now over the last 14 years, compared to the earlier days, even due to technology, is you're able to give much better service to patients and a quicker recovery rates as compared to earlier. The injection that is required to anesthetize the eye is no longer required in a majority of cases. As my other colleagues have also mentioned, is you have eye drops which anesthetize the cornea, and most of the surgery is done through the cornea, which allows a very quick post-operative healing. The common technology used in LASIK is called as phacoemulsification. Somehow the word laser has got attached to it,
Okay.
but you're not using a laser, you're using a high-frequency ultrasound. Throughout India and the world, that still retains the #1 best way to get rid of a cataract. And post-operatively, through micro-incision cataract surgery, a patient can resume normal activities just 3 days after surgery. You can restore back your normal vision. Definitely you have eye drops to carry on. You have to take care of no water entering the eye, no head bath, but it's become a very comfortable surgery. The recovery is very quick, and that earlier fear of getting under the operation table is gone.
Okay.
Newer lenses that come during surgery, now patients can get free of glasses completely if they choose to, and with multifocal lenses you don't even need reading glasses post surgery.
Okay.
So a patient actually comes back to you and says that my vision is so excellent, why didn't I think of it earlier?
Doctor, since we are going to be short of time, I have two very quick questions. One is basically about the younger generation, the youth tend to think of glasses as something that is outdated. I shouldn't be wearing glasses, and I should all be focusing contact eye lenses. So how far is this a good trend or a healthy trend?
So I think what we should understand is that as compared to the Western countries, in India you can get contact lenses over the counter, or even you can buy them online. So nobody really bothers to see the do's and don'ts, and we find many patients using contact lenses for more than 10 to 12 hours a day, not changing the lenses well enough, not maintaining the lens care appropriately, sleeping with the contact lenses on, and that's where contact lenses can cause complications.
Okay.
So if you follow the do's and don'ts accurately, a minimum of 6 to 8 hours of wear, contact lenses is a good option for patients who don't want to wear glasses. But then there's always refractive surgery and LASIK and ICL, where patients can completely get rid of glasses, provided the preoperative screening is absolutely normal. The risk of complications should be 0 for these patients.
So, Dr. Sean, as the medical director, can you just focus on the facilities that ASG Eye Hospital provides to its patients?
So we were very happy when ASG decided to open the first branch at Karanzale in Goa, and on 7th September last year we had the inauguration. We bring together a team of doctors. Dr. Aditya and Dr. Chandra Prakash along with me are available full time. We also have 2 consultants who travel from the Pune branch of ASG once a month, that is in pediatric ophthalmology, specifically related to squint disorders, and we also have an oculoplasty that is related to conditions around the eye with the eyelids and cosmetic surgeries. So what we want to focus on is enabling super specialty care under one roof, where all the different specialities can be covered by doctors with adequate expertise in each of their own respective areas. While cataract forms the majority of the practice, we're also looking into refractive surgery, as Dr. Chandra Prakash highlighted, LASIK, ICL, and other options even for elderly patients who want to get rid of their glasses. Retina forms the backbone of any eye surgery practice because a lot of patients today have retinal diseases, and there the treatment, if not given in time, can result in blindness. So that's a real backbone for many patients who have diabetic retinopathy and various other retinal diseases in the older age.
A very quick short one to end the show, and that is which you earlier spoke about, is a regular eye checkup. Actually, all three of you did. So what should be the time interval one should do his or her eye checkup?
I think a yearly eye examination is what's recommended for all of us here today, and for various reasons. In certain diseases more prevalent in the younger age group, high myopes having peripheral retinal degenerations, to elderly patients having glaucoma, to diabetic patients having diabetic retinopathy. If, however, during these examinations there is a condition in the eye which requires more frequent follow-up, your doctor will guide you accordingly.
Thank you, Doctor. Thank you, Dr. Sean De Silva. Thank you, Dr. Aditya Kazwe and Dr. Chandra Prakash Oli for this informative, detailed show on healthy eyes. I hope all of you have been enlightened with the specific issues of when we do not take care of our eyes. At the same time, the various options and treatments available to keep your eyes healthy. Please, yes, sure.
If I could just add on to, is that we are very happy last week to get the DDSSY empanelment for the government of Goa, and we would like to highlight on more of equitable care, taking care of all sections of society. We are very soon looking forward to also start a corneal transplant unit in Goa, and thank you for all your support.
So if you have your eyes issues, remember that ASG Eye Hospital also is empaneled under the DDSSY scheme, and therefore you can walk in straight to one of the consultants or the medical director himself with an appointment, and you shall be looked after well for your healthy eyes. So keep a regular checkup of your eyes. For more, subscribe to Herald TV online on all our social media platforms, YouTube, Facebook, Instagram. And if you have any queries related to your health issues, do send in your queries and they would be answered on our special show, that is Doctor in the House, in our subsequent episodes. Take care. Goodbye. Thank you.